Hello ma'am, good morning.
Good morning, ma'am.
How's your day po?
Okay lang po, ma'am.
So, may I ask your name?
Jenny Guzman, ma'am.
Your age ma'am?
15, ma'am.
Okay. So, I'm Luby Guzman, your nurse for today. I'm going to assess your head to neck. This will determine if you experiencing any current symptoms or has history of head to neck problems. So, I'm going to close the curtain and the door for your privacy. So, I'm going to observe your scalp and hair. Can you remove your hair tie, ma'am? So, I'm going to observe the size, shape, and contour of your scalp. So, I will going to observe your face shape. Then, I will going to inspect the palpebral fissure. So, it is equal to your both eyes. Can you smile, ma'am? So, there is a bilateral nasolabial folds. Slight asymmetry, so that's normal. Can you close your eyes, ma'am? Can you feel anything, ma'am?
Yes, ma'am.
Where can you feel it, ma'am?
Cheeks.
In what part, ma'am?
Left side.
Okay. Can you feel anything, ma'am?
Yes, ma'am.
Where can you feel it?
Cheeks.
In what part, ma'am?
Right side.
Okay. So I'm going to check your corneal reflex. So you are blinking, so that's normal. Can you chew or clench your jaw, ma'am? So my client is clenching with the strength and force. Okay. Next, your facial sensory function. Can you close your eyes, ma'am? Open your mouth. Can you identify that substance, ma'am?
Sweet.
Okay. Can you open your mouth again? Can you identify that substance, ma'am?
Salty.
Okay, that's good. Can you smile, ma'am? Frown. Raise your eyebrow. Close your eyelids. Whistle. Puff cheeks. Okay. And then I will going to check your eyebrow if it is symmetrical and in line with each other. And your eyebrow is color black and evenly distributed. Your eyes is evenly placed and in line with each other. Non-protruding, equal palpebral fissure. And your eyelashes is color black and evenly distributed. I will going to inspect your eyelids for position and symmetry. Then I will going to palpate your eyelids for the lacrimal glands. Do you feel any tenderness, ma'am, or pain?
No.
And then I will going to palpate for the nasolacrimal duct. And then I will going to check your conjunctivae. Can you look up, ma'am? Down, side, and other side. Okay. Can you look down, ma'am? But slightly open your eyes. This relax the levator muscle, whereas closing eyes contract the orbicularis muscle, preventing lid eversion. And then I will going to gently grasp the upper eyelashes and pull it down. Do not pull the lashes outward or upward. This too causes muscle contraction. I will going to put a cotton tip application. And I will going to slightly forward the lid. Can you look up and blink, ma'am? Then next, I will going to check your sclerae and cornea. And it seems normal and equal to left and right. And your iris is color black. The other eye is observed for consensual response of constriction. Examination of pupils involves several inspections, including assessment of size, shape. Reaction to the light is directed is observed for direct response to constriction stimulus. The other eye is observed for consensual response of constriction. Can you look in that object, ma'am? Then now, focus at my index. Okay? So, Your visualization of my index is causes papillary constriction and convergence of the eye. The room used for this test should be well lighted. Did you use any contact lens, ma'am?
No, ma'am.
Can you read my chart, ma'am?
L. Z. T.
Can you cover your right eye using your right hand, ma'am?
J. M. A.
Can you cover your left eye using your left hand, ma'am?
S. V. R.
Okay, that's good, ma'am. Can you see my pen light, ma'am?
Yes.
Okay, look my pen light, focus. Don't move your neck, okay? Next, we will going to test your cranial nerve 3, 4, and 5. So, these 3 cranial nerves are tested at the same time by assessing the extraocular movement or the 6 cardinal movement. So, can you focus in this one, ma'am? So, it seems that there is no jerky movement and there is no nystagmus. So, your gaze is normal, ma'am. Next, I will going to inspect the auricle of your ear. There is no parallelism. The size, appearance, and the position of your ears is normal and the skin tone is brown. Going to palpate the auricle and the mastoid process. Do you feel any tenderness, ma'am?
No.
Okay. So I'm going to inspect the auditory meatus or the ear canal for color, presence of cerumen, the discharge, and the foreign bodies. Perform otoscopic examination of the tympanic membrane. Note the color and the landmark. Then next, the nose and the paranasal sinuses, the external portion of the nose. So I'm going to inspect the placement and the symmetry. Then the patency nares. Can you inhale and exhale, ma'am? Do you feel any difficulty of breathing?
No.
Okay. Next, I will going to palpate the external nares, the displacement and of the bone and the cartilage. Do you feel any tenderness or masses, ma'am?
No.
Okay. So there is no swelling, exudate, and the change in color. So it seems normal, ma'am. And next, I will going to test your cranial nerve 1. Can you close your eyes, ma'am? What did you smell, ma'am?
Alcohol.
Okay. This one, ma'am.
Coffee.
Okay. Then next is the temporomandibular. I will going to palpate it. Can you stew, ma'am? So there is no crepitus, deviation, and there is no tenderness. Then next, I will going to inspect your gums. So there is no bleeding, retraction of gums, and the color is pinkish. Then next is your teeth. Okay, you have 12 pairs. Then the color is white. The alignment is good and there is no occlusion. And also the tooth loss. Your breath is good also. Then I will going to palpate your tongue texture. Can you stick your tongue out, ma'am? Okay, the texture is good. And then I will going to inspect the color. Okay, pinkish. There is no lesions. Can you say ma'am? Okay. The position and the color of your uvula is good. Then next is your neck. I will going to palpate it from the forehead to the posterior triangle of the neck. For the posterior cervical lymph nodes using my finger pads in a circular motion. Next, I will going to inspect and palpate the front and the back of your ear, under the chin, and the interior triangle of the anterior cervical lymph nodes. Then next, I will going to inspect the left and right carotid arteries. Okay. I will going to auscultate it using my stethoscope. And next, I will going to inspect and palpate the trachea. And I will going to palpate the thyroid. So there is no presence of enlargement. To inspect and palpate the supraclavicular area. Okay. Can you touch your chin to your chest, ma'am? To your right shoulder, to your left shoulder, back tip your head. Okay. So we are finished.